Okay, now I'm going to be demonstrating how to administer an IM medication. The medication I'll be using today is Maxolon, and what you have to do, explain the procedure to the patient. So make sure that they know that you're going to give them the Maxolon to make them feel a bit better. So, hi mate, I'm just going to give you this drug. It's called Maxolon, just to help with your nausea, and that way you feel a bit better. Once you've explained it to them and gained informed consent, you can go on to prepare the drug. Checking the drug, I would look and see, yep, Maxolon, 10 milligrams in 2 mils, and it expires on August 2019. I'll get my partner to check this, show it to them, make sure that they know it's the same drug and the proper drug and the proper expiry date, and then I would continue. Now, to administer this, I will give it straight as it is, and ensure that I get 2 ml of air ready so that it comes out easily. Once that's in, make sure you get the whole 2 mils of the drug out. Okay, and attached to the sharp, all the while keeping an aseptic technique. Once the sharp is exposed, sharp's out, to ensure sharp safety and make sure that everyone around you is aware that there is a sharp out, and give the patient a bit of a heads up. Before that, I would have used alcohol swab. This is before I exposed the needle. I would have used an alcohol swab to ensure that the site is clean, and once that would dry off, I'll explain to the patient it's just going to be a quick sting and get ready to insert the needle. Preparing the skin, make sure that the skin is stretched out, and once it's dry, go in hard and fast to make sure that the needle goes all the way in. Once it's in, you have to first aspirate to ensure that you're not in a vein, and if there is no blood, you can push all the way in. You can push. Maxolon is a slow push, so I'll make sure that that is done. I cannot push into this because of the actual device itself, but I would push that all the way until it's done. I'll then have my adhesive dressing ready. Once it's out, block the vein and call sharps out. Sorry, not block the vein, block the site of injection. Dispose safely of the sharps away, and make sure that the patient is still okay and that no blood is coming out from the wound, from the injection site.